I'm Dr. Sukhdev Singh, Medical Director in Primary Care at the Medical Travel Company. And this evening, for the next hour, and we will finish on time, we're here to discuss medical travel, an increasingly relevant topic in healthcare, and to look at how we can expand patient choice and access to that care through affordable private healthcare abroad in India. So, over the next half hour, we'll walk you through the UK-India healthcare pathway that we have developed. We'll share some referral guidelines and discuss some case studies. After the half hour, we will have a question and answer session, and we will finish at 8 o'clock. I know we've all had long days. So without further ado, let me introduce our esteemed panel of GPs and consultants. And if I can start with Dr. Anita Raja. Please tell us about yourself, Anita.
Yeah, so I'm Anita Raja. I'm a GP. I'm based in the West Midlands. I am the CEO of the House of Health. I still work for the NHS as well. I have a specialist interest in women's health and longevity. And we're partnering with the medical travel company in the hope that we can facilitate referrals for travel medicals to India.
Thank you, Anita. And Dr. Abbas.
Thank you very much, Dr. Singh, for the opportunity, and really looking forward to our collaboration with TMTC. I'm Dr. Nadir Abbas, consultant gastroenterologist, hepatologist, working in Birmingham. I'm also the co-founder of House of Health, one of the biggest private care providers here in Midlands, with over 20 different specialties under one roof. And yeah, I'm very excited to be part of this webinar talking about how we can facilitate our patients who are suffering with long waiting times, giving them a viable option for treatments in India.
So thank you, Dr. Abbas. And as TMTC, we are thrilled to have you on board as our private partner practice, both GP and specialist. We also have Dr. Davinder Bagary, an NHS GP. I'm not sure if he's managed to log on, and if he hasn't, we will speak to him and introduce him as soon as he gets on. There are sometimes problems with the Zoom. Anyhow, let's crack on and give a little overview of TMTC and the rationale. So can we have the slides of the graphs, please? First slide. So an increasing number of people are looking for affordable private healthcare. And going private is now becoming the new norm. I was reading some very recent articles from May this year and October this year. And about 14% of patients, which is more than ever, have gone privately for healthcare. About half of those have exploited their private medical insurance, and the majority of private medical insurance is through the employer. And the other half have been self-pay. So essentially about half of the private operations and private treatments have been through insurance and half have been through self-pay. Now, if we just glance at this graph, which gives you the NHS waiting list and how it has grown, unfortunately, in an exponential way up until now, you can see that from a waiting list of 2 million around 2010, it was growing at a pace with a fairly shallow rise. But in COVID, it escalated rapidly, and we all know why. The routine care had been stopped, and the NHS effectively became a COVID service and an emergency service. And that lasted for about 3 years. And we then came out of COVID with a shocking 7.4 million people on the waiting list. It is projected to go up to 8 million before it starts coming down by 2029, but I will be honest and truthful with you. I have seen no evidence in the 10-year NHS plan that shows how the waiting list itself is going to be reduced. And that may be a topic for the future, but essentially at the moment we have a terrible waiting list, which is about 15% of the UK population. And around 500,000 people have been waiting over a year on that waiting list for a procedure. And this is just not good enough. So next slide, please. And if we break that waiting list down by speciality, you can see that the largest numbers have been waiting for eye surgery, whether it's a cataract, a vitrectomy, and a large number have been waiting for big orthopedic procedures. And out of eyes and orthopedics, the orthopedics is by far a bigger operation on your body, such as a knee replacement or a hip replacement or shoulder surgery or back surgery. And at TMTC, we have decided out of this list of elective surgery that we are going to focus on trauma, well, orthopedics primarily, but we will look at ophthalmology, gynecology, and general surgery. Next slide, please. Now, this is the last 6 years to show how the waiting list has grown in each of those clinical specialties. And there's been a 35% growth in ophthalmology, a 30% in trauma and orthopedics, and nearly 30% in gynecology. And that is just a huge number, and it worries all clinicians in the NHS, whether you're GPs, whether you're consultants. This is always a grey cloud that's overhanging us. And we need to find a way of helping reduce that waiting list. So patients can no longer tolerate these long waiting lists because they tend to be in pain, their function is reduced, they tend to have time off work, and the more elderly get very housebound and they lose their independence and become dependent. So what happens then? Well, a large proportion of them go for private care. And when they look at the UK private sector costs, they have to put their hands very deep in their pocket to afford the very steep private sector fees, which, for example, let's use knee arthritis and a total knee replacement. The UK sector prices range from £14,000 to £18,000, depending on what you're having and the prosthesis involved. And most people cannot afford that. And most of these patients are over 70. And the sad fact is, if you have private medical insurance, but you had knee problems before you took that insurance out, you are not covered by that insurance. So a significant proportion do still end up with self-pay. And a lot of patients are now deciding to take this into their own hands and look elsewhere for traveling abroad. But when you go on your own and travel abroad, you can get involved with the logistical stress when you get to, for example, Poland or Turkey or Hungary. Which hospital are you going to go to? Which consultant are you going to see? What is the outcome going to be like? Is there any guarantee? And the other problems are often cultural barriers and poor post-operative care. What if something goes wrong with your operation when you come back to the UK? What can you do? And all of these issues have been major concerns with medical travel. So what we have done at TMTC is develop the ecosystem that was lacking before. We've plugged the gaps with clinical governance, clinical oversight, and we have de-risked those areas that have caused concerns before. Early this year, I was in India for 7 days vetting the top Indian hospitals and the top Indian consultants. And the week before, Professor James Kingsland, a very well-known and respected GP in England who's worked at the Department of Health, he did the same. He spent 4 days, and we were astonished. We were amazed at the quality of hospitals in India. Now, not all hospitals are great. Not all hospitals give you the best care. And a recent report in the Economic Times of India reported that as little as 55 hospitals in India out of 43,000 hospitals are accredited with an international external validation system called JCI. JCI is an international accreditation system which is used in the US, Australia, Europe, but in the UK we have CQC. So that was a big surprise to me. And when I went down that list of hospitals, I was glad to see that the hospitals we are partnering with, such as Fortis Memorial in Gurgaon, are on that list. And we scrutinise the safety data, the quality data, the performance of consultants, and they were tip-top, on par, if not better than the NHS in some cases. So we have a third pathway that we now can offer patients, a viable third pathway of private care, but at less than half the cost of UK care. Can we have the next slide on the medical pathway, please? So this is that was just a general slide about who we are and what we do. But what I'd like to do is go on to this medical journey. We call it the patient pathway. What happens to a patient when we pick them up here and make a health plan with them and take them through the process to the end, where they come back and they have recovered from their problem and they are therefore discharged. And this is called the medical travel journey. Some call it a patient pathway. There are several points in this pathway, in this journey, that are very unique to TMTC. And I'd like to focus on the first one, which is GP consultations in the UK. We have partnered with a group of private GP practices across the country. And in Birmingham, our primary partner is the House of Health. And we have Dr. Nadir Abbas and Dr. Anita Raja representing the House of Health. When a patient signals an interest in wanting IVF or implants or an elective surgical procedure, they have a 15-minute mini consultation with myself. I ensure that they understand that this is going to India, that they are mobile enough, and that they have their clinical records, because when I then refer them into our private GP practice, their condition is assessed and the suitability of an operation is just reconsidered. Even though the NHS surgeon will have said, you need this operation, we just do a double check. And with the patient, we do a joint healthcare plan. So we are involving the patient in a healthcare plan. This is different to a patient just getting on a plane and going to another country, looking around, not having any healthcare plan. Once our patient has had that first consultation, the private general practice use an electronic health record. They load all the information. I look at that. I share that record securely through GDPR with our Indian consultant at one of our chosen vetted hospitals. We discuss a treatment plan, and once it's all approved prior to travel, we okay it with the patient signs their contract, and away you go. You're on the plane to India. Now, there is some travel preparation needed. We expect the patient to pay for their own airline ticket, but we do the rest. So the travel preparation often includes a medical visa, which is normally given very quickly because India is very keen on getting international patients over for medical healthcare procedures. We also will pick them up from the airport, take them in our chauffeur-driven car, and take them to the hospital where they are going to have their procedure. And that is all very, very VIP. And once they are in the hospital, they get that top level of treatment. I also want to labour on another point. People have a choice in life. You can either drive a Mercedes, a top quality, or a BMW, or dare I say, some people can drive a Bentley. But at the same time, you could easily drive a Ford or a cheaper vehicle. But people are interested in driving quality and having that. So we have purposely chosen the highest quality of care, with the highest quality hospital, with the highest quality surgeon for the highest quality of outcome. And that does come at a slightly increased cost, but we believe your body is worth it and you deserve that. Yes, you can find cheaper operations in India at unaccredited hospitals, and we are not here to compete with them. We are here to give you the best patient experience and to enhance your quality of life. So world-class treatment, and following that, you will often have to recover after an operation because you cannot fly straight back to the UK. And a knee operation, for example, will need 4 weeks in India, so normally another 3 weeks in our aftercare post-op recovery centre. And you have all-inclusive meals, a nutritionist to ensure you have the tip-top meals. The meals with a high protein content, because after an operation, you've got to get good healing of your wounds. And that does not happen on its own. You need to help healing through, number one, good high protein intake, and number two, physiotherapy. And we have a physiotherapist on site who will, as an example for your knee replacement, you will have physiotherapy every day for 3 weeks. And by the end of the 4th week, you should really be up and fully functioning and ready to fly back, and we give you a fitness to fly certificate. When you then land back in the UK, can we go back to the medical pathway, please? When you come back to the UK, you will then come back into the arms of that private GP practice, let's say House of Health, if you're a Birmingham patient. And they will then look after your post-op recovery with 2 further appointments, one at about 6 to 8 weeks, one at 3 to 6 months. And lastly, the cream of the cake for us is a 12-month private insurance, which we have added into the total package when we discussed this with you right at the outset. And that private insurance covers your body operated part, and it applies to all elective surgery, and it applies to implants. Now, with a lot of other countries, if you have an operation and you come back to the UK and things go wrong, what has happened, and the media has made a big meal of this, the patient ends up going to NHS A&E, and there the hospitals are already overloaded and they're not very happy to look after the mistakes of surgeons or doctors from abroad. And you may not get the best of care. You may have to get re-referred by your NHS GP to another NHS consultant in this country, who again tends not to be happy to deal with all the problems that you have come back with if there are complications. And if you call Hungary, for example, where you had a knee replacement, they will say, come back to Hungary and we'll have a look. And when you've bought your ticket and you get back to Hungary, they will say, yes, this costs another £3,000 to correct. So the high risk of complications in post-operative care is a big issue. And we have managed to find a very good solution, which is your UK-based private medical insurance. Anything that goes wrong is going to be dealt with here. You do not have to go back to India for anything at all. And if you need to see a specialist, you will see a private specialist here. Now, next slide, please. And the one after that. Okay, if that's the last slide, let's stay on that slide. Today is all about how do we engage with you, our delegates who have come on board. How do we get you to help us and help patients by bringing referrals into our pathway? And that is the role that I now think GPs can play to ensure safe medical travel. We can't just let patients go on their own solo and end up in despair. So I will like to walk you through on how to refer to us step by step. So firstly, in your NHS practice, you may identify a patient with a long wait, or someone who comes to you and just says, I can't wait any longer, it's unbearable, but I can't afford the private fees either. And what do? Well, you have a quick look at their records and you say, can't do much, but now you have this third viable option. You can point them in our direction. You can just navigate them to us and say, have a look at or consider TMTC. And we are not getting the GPs to make a medical recommendation because that brings a responsibility on you as an NHS GP. All that we're asking you to say to the patient is, have you considered the travel abroad to India via TMTC? And that essentially is the way that we would like referrals to occur. So I now want to come on to getting our panel in to answer some questions. And after those questions, I would like to then open up to the floor for any questions, and we will try and answer any questions that you may pose. You can also post questions in the chat box, and we will try and look at those and see what we can do with those. So Dr. Bagary is not here yet, but I will go straight over to Dr. Anita Raja to ask, having said everything I've said, as a private GP, how do you feel you can enable medical travel to India via TMTC?
I mean, as a private GP, the first thing that we have seen is that people only turn towards private care when they are absolutely fed up by the long waiting times on the NHS. And it's incredibly difficult. It was incredibly difficult for us to find credible partners where we could refer these patients or give them an option. And I totally agree with what you've said, where you've said that, asking them to go abroad for medical care puts the responsibility on the GP. However, as GPs, we must give our patients the option if they were to take that option. And being in the Midlands, I mean, that's where we are geographically placed. It gives us the options of exploring this, very efficient option with patients who may well be originally from India, having relatives in India, and happily would consider traveling back to India for these surgeries. Because I guess the thing that is very different about TMTC also, Dr. Sukhdev, is that the surgeons that will be operating on these patients are surgeons who have qualified from the UK or are still on the UK GMC register or are from the US. So these are surgeons who have worked in Europe, America, have done their training from Europe and America, which gives them that additional added credibility, because credibility is everything. And then the other thing that we'd worry about being a GP is what happens once they come back. And of course, there can be post-operative side effects, complications, risks. It could be infection. It could be anything. What happens with the patient then? Is this patient going to become a burden on the NHS? So I still work for the NHS. And I feel that it's our responsibility that we take that burden off the NHS and support the NHS rather than putting more burden on the NHS. And we see that a lot with patients who come from Turkey, where they have had, plastic surgery, gastric bypasses, and then there's absolutely no follow-up care. And they end up, in A&E, in an NHS A&E somewhere in the country, which then clogs up the system again. So, the fact that TMTC have this 1-year post-operative insurance cover within the UK gives us the reassurance that it's a safe pathway.
Thank you, Dr. Anita. Can I also ask you, what type of patients do you think will benefit the most from our pathway?
I certainly think that fertility is a big one, because on the NHS, the guidance is, may I say, absolutely ridiculous when it comes to offering IVF to patients. It's so strict and so stringent that I almost feel that it's impossible to get onto that pathway and qualify for IVF on the NHS, 9 out of 10 times. If you're overweight, you don't qualify. If you smoke, you don't qualify. If your partner has a child from a previous relationship that you have absolutely nothing to do with, you don't qualify. So there are lots of reasons for not to qualify for IVF on the NHS. And we also now know that a single cycle of IVF may not be productive, so we may need multiple cycles. And in the private arena in the UK, IVF is extremely expensive, and a person on a normal wage can certainly not afford it. People have to remortgage their houses, sell their cars, take loans, and the outcomes aren't great. So I think fertility is a big one. And I also say this because I myself have suffered from infertility, secondary infertility, for a long, long time. I have a 7-year age gap between both my sons. And I certainly know how painful and tedious that pathway is, and, the waits are, and on the NHS, nothing happens on time, especially when it comes to infertility. And sometimes you're running out of time because your biological clock isn't stopping. But in India, the sort of technology that they've got in terms of fertility, egg freezing, egg donation is incredible. And I think fertility is certainly going to be a big one.
And in relation to that, there was a report recently about egg donors. And in the UK, there's a dearth. There are very few South Asian donors. And I think it represents only 4% of all donor eggs. So if you were 35 or older at 40, where you only have a 10% chance of getting pregnant, and you go for donor eggs, it's very difficult because you may not be able to find an Indian or a South Asian donor. And you therefore are even more stressed because now you're going to have to take on an egg, a gamete that is not really what you wanted originally. And I suppose that's another benefit of going to India. What are your views on that?
Certainly. And I also feel that when it comes to, so we objectively do not understand the struggles and the challenges that a family face when they are suffering from primary infertility, secondary infertility, trying for a baby, not being able to have that family. Because that family is primarily focusing on having a very positive outcome, which is having a child. That's what they're trying for. Now, the system in itself has so many hoops and is so restrictive, and it's so challenging to get through that system that once you are on that list, you would consider yourself lucky if you do land on that list. Once you are on that list, it becomes incredibly difficult for you to be a chooser, because beggars cannot be choosers. And you wouldn't want a family where of course, there's this cultural barrier, and also you wouldn't want a family that doesn't look like quite like you. And I feel that the opportunity of having children, if I want to put it out straight, that look like you is great. And also the opportunity of having children in a country, in a culture that is familiar, is even better. And the opportunity of having children in a country that is familiar, understands your culture, with children that look like you and is affordable, is even better. So I guess it's a new concept, and I think it will take time for us to be able to get amenable to it. But there's certainly scope, especially for families that are trying to have a baby and are not being given the opportunity here due to the lack of funding and the way the system is designed.
So just in relation to that, I also still work as an NHS GP, and I've had several patients, women who are 35 and cannot conceive, and they say, we are going to wait for a donor egg. And they wait 2 years, and their chance of succeeding drastically reduces year on year. And it's just horrible to see. But thank you for your answers. And for our delegates, just a little quick point. Anita, Dr. Raja, is obviously a natural TV person because she is the TV doctor for Good Morning Britain and goes frequently. So if you're ever at home in the morning and you've got nothing to do, switch on the TV and Dr. Anita Raja will be there answering all the health questions. So thank you, Anita. That was really good. Can I now turn to Dr. Nadir Abbas, who is a consultant gastroenterologist with a speciality in liver medicine? We've talked about the GP view, and GPs are the primary referrers in the NHS. And from a private clinic, they tend to be the primary referrers. But now you are also a referrer through your private clinic. What is your view on becoming a referrer and your view on medical travel per se?
Absolutely. So, Dr. Singh and the attendees, I'm sure we're all aware of medical tourism. When we came into House of Health just over a year ago, and even before that, when we work in the NHS, we know that people have been traveling. Whether it's Turkey, Dominican Republic, Egypt, certain parts of Asia, Middle East, and of course India. I mean, India has been top of the list when it comes to live donor liver transplants. Certainly something that I have experience in my field. And, world-renowned surgeons there, one of the best transplant centers in the world. So we have certainly experienced and have good relationships with centers in India. So medical tourism is not new. However, what's always been missing is that concierge service, whereby you are able to have someone handhold you from the UK, having that level of trust, meeting the person virtually who's going to be operating on you. And of course, that kind of full round package of wraparound, when it comes to travel, when it comes to reputable surgeons, and of course, post-operative care. I think that is huge, like Anita touched upon. We have in the NHS, seen people coming in with post-operative complications, and that is common. It's not uncommon for people to have issues, and having that kind of system in place whereby you're able to see, for example, House Health or other private providers if you have any issues. It's often little things that need tweaking. It's not that everyone needs a reoperation. So it's having that kind of cushion when they come back to the UK. I think that is fantastic. In terms of medical tourism, I mean, I think that is the future, like you mentioned many times, and we're all aware of the long waiting times, specifically for certain surgeries, orthopedic being one. The waiting times are huge. And people now, I think we as physicians, I think it's our job. At the end of the day, we have to think about our patients and what is in their interest. And I think what's in their interest is giving them that option, that you have an option available, which is 7 to 8 hour flight, much cheaper. You'll find very experienced surgeons there. And of course, one of the things that we had apprehension with when we thought about, when you first approached us, was, are these people reputable? If we are referring a patient from House of Health or from UK, you do have this general hindrance. That's how what we're taught in the NHS. We're in a box. We like doing things our own way. But when we've obviously looked at the brand, known the kind of hospitals that are taking part in with TMTC, the kind of operations, the way things are being done yourself, it's given us that confidence that we can confidently refer our patients and people who are looking for surgeries.
Thank you. And I'm going to give you a tough question now and make you the Health Secretary. Is there a solution to tackling the 7.4 million waiting list in the NHS that you know of?
I mean, that's the golden question, isn't it? I wish we knew the answer. And like you said, the 10-year plan, and I was just reading the papers today, actually the NHS is entering the winters in the worst state ever in the last 15 years. And the Labour government is new. The challenges they are facing is absolutely new. They're absolutely new to it. So I think things are, personally, looking at the NHS, the financial state of it, it's just November and the hospital's already full. And we know this is going to have a ripple effect on all the surgeries being delayed. So the frank answer, being a physician working in the NHS, having my heart in the system, is that the waiting times and the overall situation is only heading towards getting worse.
And being a super speciality consultant in Birmingham, in the second largest city in the UK, in the best hospital, the University Hospital Birmingham Trust, the winter period, sometimes referred to as winter pressures, is a big issue for 4 months. Can you give me your experience of what happens over winter with routine elective care?
Yeah, absolutely. I mean, we've had, I do endoscopies, and just to put things into perspective, when we have winter pressures, the front door or the accident emergency takes precedence, which means patients, when they come in, they have to be, taken care of because they can be ill and die. They're being treated, and they take priority over everything, which means cancellation of elective procedures. I've had my endoscopy suite being taken over by patient beds and not been able to provide any endoscopy service for a full week in a big center. So you can imagine that is the level of pressure that the hospital's in. We all know that there are certain facets of care that every hospital has to meet in order for them to be at a certain level. The criteria that they have to meet, which is one of them, is 4-hour wait, 12-hour waits. Those are absolutely tarnished when when the winter pressures are there. Ambulances are unable to offload, and again, elective procedures are absolutely the waiting times just keep going up and up, and they're cancelled.
And I saw some figures from the last 5 days of resident doctor strikes earlier this year, and the waiting list went up by 221,000 patients, and we have another one in November later this month. So that, on top of the winter pressures, is just compounding the problem. And it's clear that a very large proportion of the waiting list have been waiting over 1 year.
Can I just say, there are other aspects that are going to make the waiting list worse, and this is something that we have been seeing. One of them is staffing. We all know that at the moment, staffing crisis is still there. Number two, our training numbers. Doctors are struggling to get into training numbers, which means that there is a huge backlog of people waiting to come into the system. Of course, like you mentioned, the junior doctor strikes, they have a huge effect on right now. And it's planned for next week. And, we've had to cancel our elective activities, including clinics and, operations and procedures, just purely to support the front door. And I think the other thing that people are not looking at, and I have a keen eye on, is the mass exodus of doctors leaving the NHS, going to other countries because of the situations that we've discussed in this webinar before. So I think all of these issues are only going to make things work, and they're going to create this vacuum where people are going to look for other alternatives. And we've had some really good experiences. I mean, Anita can tell you, we've had some amazing experiences with patients going to Turkey, for example, and, traveling, getting themselves sorted out and coming back. And why not?
Yes. No, I totally agree. There are pockets of excellence in a lot of the countries abroad.
Yes.
And, when you read the global healthcare projections, the one thing that's clear and outstanding is India will be the premier medical travel destination by 2030 by virtue of having so many brand new high-tech hospitals with the latest facilities, with the largest capacity of doctors in the whole of Southeast Asia, including China, Indonesia, and everyone is looking at India to provide solutions. So thank you very much for that. I just want to now, before I open up the floor to questions, want to just say, what does the road ahead look like for TMTC? What do we want? What do we want from our private partners like House of Health? What do we want from our NHS GP partners who decide to start working with us, such as Dr. Bagary? And I'm sorry that Dr. Bagary couldn't be here with us. I'm sure he might come on in a while.
Sukhdev, I am on the call now. I don't know whether you can see me.
Hello, Dr. Bagary. How are you?
Evening. I've been on for quite a while, but I don't know whether you could see me or not.
I couldn't see you, and I thought, we're missing our NHS GP. So
the panel, probably a lot of people want to see, but I have.
No, it's lovely. It's lovely. So the way we designed our panel is we wanted NHS GPs represented who are interested in taking on some private practice, not totally private, an arm of a private portfolio, and a pure private practice like House of Health. So Dr. Bagary, can I ask you a couple of questions before I do open up to the floor? What was your initial reaction to the idea of referring NHS patients for private treatment abroad in India?
Just a little bit of perspective, really. I mean, I'm a working GP in the NHS for over 30 years, and listening to the conversations this evening and colleagues, I share all the concerns. So with any new private provider, you've got that bigger concern is patient safety and clinical safety, the governance, the structures, the accreditation, and all the safety measures. And I think throughout the evening, I think all of those are being covered off. And that was the assurances with the onboarding process that MGS had with TMTC. Having the one-to-one meetings was very important. Having the structured meetings was very important as well. So, and all those assurances, and I think with the colleagues already mentioning, the people involved, their professionalism, their backgrounds, their senior leadership roles within their own organisations and within the NHS, and having seen a lot of the videos, the presentations at the Best Practice Show with people like James Kingsland involved, who's a recognised GP. So all of those assurances was huge for me. If you're explaining to patients, the simplest thing I always look at when I look at private provider is, would I go and see them? And the answer is yes, with all the assurances and everything I've seen to date.
Thank you, Dr. Bagary. And I can't remember if you're a cricket fan, but you know what I'm going to ask you.
I am a cricket fan, but I might not know the answer to this question.
Okay. So in the summer, we were very happy to announce that the English and the Indian cricket team invested in TMTC in a big way. And they have an investment group. And for us, we felt that brought us great credibility and legitimacy. And I think it's just something I wanted to share, not just with you, but with also our delegates, to show that we're not just a fly-by-night group. We are now getting increasingly recognized as a very a very good model of a healthcare startup company, which I honestly do think has got a great success coming along in the near future. So you've told me what's reassured you about the TMTC model. Before I go on, I gave Dr. Nadir and Dr. Anita a chance to tell us about themselves. You weren't here at the time. Can you just tell the people who are on the webinar a little bit about yourself, because you are a GP Wolverhampton MGS Healthcare?
Yeah, I'm a working GP, Sheffield graduate in 1990, so I've been working in the NHS for over 30 years, seen lots of change, not all for the good. Also, locally, I'm on Wolverhampton Local Medical Committee as an LMC officer, part of Wolverhampton British Independent Doctors Association. Those are my roles outside the surgery, and clinical lead roles over the years in various things from mental health, learning disabilities, autism, drug and alcohol services as well in Telford and Wolverhampton. So
and after meeting you,
experience.
Yeah, great. It's great. And that's why we're so happy to have you on board. And when we met at one of the community events, the enthusiasm you had and your wife, who's the practice manager, had in joining us was really warming to us. And now that you've taken that step and signed a contract with us as an NHS GP to look at cases that can be referred, what message would you say to other NHS GPs who are on this call or wider about medical travel and partnering specifically with TMTC? Is it something that they should consider? Would you recommend it?
The answer is yes, and I'll explain why. I mean, we've all talked about the NHS waiting lists, and the waiting lists have been a problem for a number of years. Obviously, since the pandemic, the waiting lists have got longer and longer. And most of us are experienced clinicians, if not all of us in the NHS, and we're all saying the same thing. Those waiting lists are not going to come down anytime soon for multiple factors. I agree, workforce is a big problem, and sickness is another problem in the NHS now. And obviously the strikes don't help, but so there's multiple factors why those waiting lists aren't going to come down, on top of the fact patients are living longer, primary care are referring more and more into specialist services, and there's a limited workforce to do more work. So from a working GP, you've got your patient in front of you who's saying, look, my waiting list, 2 years, 3 years possibly, what are my options? Obviously, not everybody can afford to go private in the UK. So a lot of people do explore abroad. And a lot of patients will come to their GP because they trust their GP. They've known them a long time and say, look, doc, where would I go? We know about the local private providers. Private providers abroad we're not aware of. With TMTC, you've got, I think Dr. Nadir put it brilliantly, well, you've got that concierge service. You've got a point of contact. You've got somebody who will guide you through it. Whereas when you're chasing around finding all this out yourself as a patient, you might have a conversation with your GP, but they're going to say, look, I don't really know myself. And you haven't got the time to find out for that patient. Whereas with this, with TMTC, you know that governance structure's there, and you've got a point of contact, not just before you go with a GP in the UK. You've got virtual consultations before you go and see the people that are going to undertake surgery. You've got a 12-month aftercare package. You've got the same GP when you come back. So you've got a lot of continuity of care and the same point of contact through that patient's journey. That's where patients, you can reassure them more and more. Because the biggest thing is patients are going to say, look, if I'm going to pay the money, I'd rather pay it somewhere who's going to do it well and not have the quality and the outcomes that provides.
No, thank you, Dr. Bagary. I was looking at a report from an actuarial document, a report, which was looking at private healthcare. And they made a headline which said, private medical care is becoming the new norm. Patients are increasingly having to go to look privately. And I'm pleased to say that we want people out there, the public, we want doctors out there to understand that we are that third viable option at a very affordable price. Now, I'm going to give a few little summary key takeaways, and then I'm going to open the floor to questions. We've gone quite far ahead of time. So we have a new, safe, ethical choice for patients through our pathway. We have a doctor-led model with clinical oversight, which ensures trust and transparency. And the UK-India collaboration that we formed is on a very different level to other health travel organizations. The opportunity to extend this third option to patients without compromise is really vital. So having said that, can I open to the floor for any questions, and the four of us will try and answer those.
So their first questions come, actually quite a pertinent question, is how much would, for example, a knee replacement cost a patient with TMTC? And then my question on top would be, what would be the difference in price compared to UK?
Okay, now we need to compare like with like. And I have done some calls to private knee clinics in the UK. And the cost of a total knee replacement, one side, is between £15,000 to £18,000. Yes, there may be one or two smaller private clinics in towns or small cities that might do it for a bit less. And what that essentially is just the operation and one consultant outpatient appointment after the event. It doesn't usually have any major physiotherapy built in or anything to do with complications. So with TMTC, I'd like to give you not a comparative quote on just the operation, because we don't do that. We don't want to just give a patient an operation and say, now do what everyone's always done. We have tied in a package. So the operation for your knee, plus 3 weeks in a very premium aftercare center, which is like a home from home. You could call it a 5-star service, all inclusive, with physiotherapy, with 24-hour nursing and a doctor, plus your 1-year aftercare insurance, which is extremely expensive, by the way, plus your 3 GP appointments, collectively come to less than half of the 18,000 usual price. So we have that price point at about 9,500. I will also say our prices, once we discuss it with you, are fixed. So you don't have any nasty surprises where you go into a hospital, they call you in for 3,000, and by the time you leave, it's 6,000. So variable pricing occurs in the majority of medical travel situations, but we have overcome that with a fixed price. So at less than 50% of the cost of just a UK private operation. But if you add 3 weeks of the aftercare facility that we have in India here, and you add in the 1 year of private insurance, that £15,000 to £18,000 becomes £20,000 to £28,000. So 9.5 versus 20 to 28, taking account of the super expensive hospitals like the Cromwell Hospital in London to a private hospital in, say, Doncaster. You're on mute. I can't hear you.
Second question is about prostate operation. Is that something you are looking into? And any idea of the cost associated with that?
So we have had patients logging on through our social media sites, Instagram and Facebook, and we've had 2 queries on prostate operations. And yes, we do all types of elective surgery. And we have a specific urologist in Delhi and Gurgaon who will do the prostate operations, whether it's HOLEP or green light laser therapy. One other thing to mention, a lot of the surgical procedures we have signed up to in India are the latest high-tech robotic surgery or laser surgery, and those with the least amount of complications. Pricing is again less than half of what you pay in the UK. So if you look at a price which includes aftercare and consultant aftercare, it could reach £7,000 here. In India, it's going to be about 3,500. These are just ballpark figures. We haven't got exact figures because once a patient tells us they want a particular type of prostate surgery, and I'm not talking about prostate cancer, we will also deal with prostate cancer. We will discuss it with a surgeon in India. The hospital will give us the price, and we will discuss that with the patient. And as I say, our general ballpark figure is it's about less than half of what you would pay here. But you have the added benefit of the aftercare, full aftercare in India, and the 1-year insurance should anything go wrong when you come back here.
Sure. So I think it's important to understand it's not just the operation like to like, but it's the additional things that are
It's a
being
full
given.
package.
It's a full package.
And I know patients sometimes look at our price and say, oh, but I can get that done for a bit less. Yes, I do understand that. But as I said earlier, it comes down to what do you want your body to actually go through? How do you value your body? What does your body deserve? Do you want a mini service or a Rolls-Royce service? Do you want to drive a Jaguar or do you want to drive a Ford?
The next question is around India and image. So India has an image issue. How and what are you going to do to promote that India is the place to go for medical procedures?
That's a very good question, and we're working on that. And we will be having a webinar soon called Dispelling the Myths of Medical Travel to India. I will be honest, I was a skeptic about care in India because I had not gone to India for 42 years since I was a child. And I went about 8 years ago. And then when I joined the medical travel company, I had a really deep insight into what healthcare in 2025 and beyond looks like. And I was just astonished and amazed at what there was there. Yes, if you want to go on your own to India to have a hernia operation, and you go to the back streets of Jalandhar and you find a clinic for £500 or somewhere else, yes, you're going to get what you've paid for. You have to always look at, and I'm not saying Jalandhar is a bad area. I'm just saying if you went to a non-reputable clinic that's got no validated data, and I know patients do go for price only, then you are going to end up in problems and complications. So yes, dispelling the myths is something that we're going to work on. And I do really feel for a lot of our South Asian patients go to India and go to small clinics that call themselves hospitals, charge a little bit less, and that affordability, low price attracts them, but then they get caught up. And I only mentioned this Jalandhar name because one of my patients went recently and I was just horrified that that had happened in a backstreet clinic.
Sorry, just to come in on that as well. That was part of the assurances that I wanted before coming on board, was the quality and the safety measures. So yeah, but it's not all about, it's like here in the private providers here. If you go by price only, you're not necessarily going to get the quality and the safety measures associated with that.
Yeah, absolutely.
And that's where the TMC brand does tick all of those boxes.
Yeah. So when I mentioned earlier there are 43,600 hospitals in India, there are another 37,000 clinics in India, all over, who are actually clinics, not hospitals. They are run by people who call themselves doctors, but they're not always doctors. And it is very easy for the average person to get conned or scammed by, I'm going to this clinic and this doctor, who may not be a doctor, has promised me everything for such a low price. How can I say no? And that is what I really want the public to avoid.
Last question. Do they do a TERP for prostate in India?
Yep, they do a transurethral section for benign prostate, and there are several different ways of doing that. The popular way is called a HOLEP, a laser surgery. There's green light laser therapy. There is a traditional way of carving out the prostate, but it's done robotically, and therefore you have minimal bleeding, minimal pain, minimal disruption to your urethral valve, the control of your urine. Because often after a TURP, one of the big complications is you can't control your bladder, and the valve is damaged. So with robotic surgery, you often get preservation of that urethral valve. So having just an operation and having the prostate removed or carved out under TURP is not really what you should be after. You should be after a quality of life for the next few decades where you can control your urine and you can lead a normal life without being permanently incontinent. So yes, the answer is yes, and you would be offered different options. But for our last patient, we advised a HOLEP after discussing it with the Indian urologist.
I think that's it for questions. Thank you.
Well, thank you, Dr. Abbas, for holding the fort on the questions. And we come to 8 o'clock, and I'd like to close. Can I invite up to a 1-minute final remark from each of you? And whilst you're on, Dr. Abbas, do you want to start the first final remark?
Yeah, absolutely. I mean, I think it was fantastic. Just to put things into perspective, you've summarized the whole of TMTC grand plan in a very nice fashion. I think we're very excited to kind of see where this goes. Medical tourism is on the rise, and numbers are going up, and we're excited to offer patients this extra pathway where they're able to not only get their operations and issues with regards to their medical conditions sorted out, but also have a 5-star holiday.
Yes, and that's one thing I omitted. When you are in India, it's not just the operation. When you are in the aftercare center, you can bring your partner or your number 2 along, a friend, whoever, a companion, and they stay there for free and they are fed all inclusive. Plus, you can use our taxi chauffeur at any time, and you can go shopping, you can go sightseeing once you're up and around. So yes, before you're fit to fly, you could well have a very decent holiday, plus having had that healthcare operation. So Dr. Anita Raja, give me your final remark, please.
So, as a newly established private healthcare group here in Birmingham, and being the CEO of the company, for us, I think one of the biggest challenges would have been partnering with a company that we can trust. So, trust is everything for us, credibility is everything for us, because I think when you are trained in the NHS, you have the best of your patients at heart, even as private healthcare providers. For us, credibility is everything. And I still remember the day, Dr. Sukhdev, you came to our clinic and you spoke to us about TMTC, and you yourself being an esteemed NHS GP all of your life, working hard within the NHS. I think that was the first, point of credibility for us to review. And of course, we trust you, and we've looked at the whole floor plan of TMTC now, from the point of contact with the patient up until the patient comes back to the UK and the aftercare. And we're incredibly excited to be part of this. And I think that it's certainly a very safe pathway for our patients, and something that we can offer them, especially if they cannot afford big private surgeries in the UK.
Thank you, Dr. Raja. And Dr. Bagary, what are your final remarks?
Yeah, thank you for that. I mean, it's really the patient's the focus in all of this. I think we're all saying the same thing, and protecting the patient, directing them to a pathway that you would go on yourself. That is the biggest thing about TMTC: the quality, the safety, the accreditation, the concierge service, the aftercare, and continuity of care, and that consistency of clinicians throughout, and quality of clinicians involved.
Thank you. And I'll just give my final remark. I really do hope that any of the clinicians on this meeting do explore the pathway on www.themedicaltravelcompany.com and refer to us when it's appropriate, and really be part of reshaping global healthcare collaboration And when we meet again, obviously we'll have meetings in between, but let's go forward to 2030. I want us to be in a much happier position where we can say we have helped so many patients come off the waiting list and get the care and the outcomes that they've deserved. So we look forward to your referrals coming into TMTC. We will look after them, really look after them. And for any more information, you can reach out to me, or you can use the contact details on the screen and get in touch with us. So thank you very much for your attention and for staying for the whole hour or even part of the webinar. And we will soon have a few other webinars, including dispelling the myths of medical travel to India. So thank you for joining us.